Understanding Parkinson's disease, an in-depth exploration. Parkinson's disease, a neurodegenerative disorder that affects millions worldwide, is a complex and challenging condition that demands a deeper understanding. In this comprehensive article, we delve into the intricacies of Parkinson's disease, its origins, classifications, and the potentially devastating consequences it can have on those living with it. Unraveling the origins of Parkinson's disease. Parkinson's disease, often referred to simply as Parkinson's, takes its name from Dr. James Parkinson, who first described the condition in 1817. It's important to recognize that while we've made significant strides in understanding this disease since then, its exact origins remain a subject of ongoing research. The fundamental pathology of Parkinson's lies in the progressive loss of dopamine-producing neurons in the brain. Dopamine is a neurotransmitter responsible for facilitating smooth, controlled movements. As these neurons deteriorate, the brain struggles to transmit signals that control movement, leading to the hallmark symptoms of Parkinson's, such as tremors, rigidity, and bradykinesia, slowness of movement. Learn more about managing Parkinson's disease in our specialized course. Classifying Parkinson's disease. Parkinson's disease can manifest in various forms, making it crucial to classify the condition accurately. The primary classifications include idiopathic Parkinson's disease. This is the most common form and has no identifiable cause. It typically develops later in life, with symptoms gradually worsening over time. Secondary Parkinsonism. This form of the disease is a result of other factors, such as medication side effects, head trauma, or vascular issues. Identifying the underlying cause is essential for effective management. Genetic Parkinson's. In some cases, Parkinson's disease has a genetic component. Mutations in specific genes, such as SNCA, LRRK2, and PARK2, can increase the risk of developing the condition. Understanding the dangerous consequences. Living with Parkinson's disease presents a multitude of challenges, not only due to the physical symptoms, but also because of the potential dangerous consequences it can entail. Let's delve into some of these serious ramifications. Falls and fractures. Parkinson's patients often experience balance and coordination issues, significantly elevating the risk of falls and subsequent fractures. Hip fractures, in particular, can lead to prolonged hospitalization and a decline in overall health. Swallowing difficulties. As Parkinson's progresses, swallowing problems, known as dysphagia, can emerge. This can result in choking, aspiration pneumonia, and malnutrition. Cognitive decline. While Parkinson's is primarily associated with motor symptoms, it can also affect cognitive function. Many individuals with Parkinson's develop mild cognitive impairment or even dementia, which can profoundly impact their quality of life. Psychological challenges. The emotional toll of living with a chronic, progressive condition like Parkinson's cannot be overstated. Depression and anxiety are common among patients, and these mental health issues can exacerbate physical symptoms. Early warning signs and risk assessment. In addition to understanding the origins, classifications, and consequences of Parkinson's disease, it's crucial to recognize the early warning signs and conduct risk assessments for this condition. Early detection can lead to more effective management and improved quality of life for individuals at risk. Tremors. Persistent, rhythmic tremors, often starting in one hand, can be an early sign of Parkinson's disease. If you or a loved one experience unexplained tremors, consult a healthcare professional for evaluation. Bradykinesia. Slowness of movement and difficulty initiating movements can also be an early indicator. This may manifest as a struggle to perform everyday tasks smoothly. Muscle rigidity. Stiffness in the muscles, especially in the arms, legs, or neck, can be an early symptom. It may feel like muscles are harder to move or relax. Postural instability. Difficulty maintaining balance and a tendency to fall, especially when changing positions, can be a warning sign. Changes in handwriting. Parkinson's can cause micrographia, which is a reduction in the size of handwriting and a gradual deterioration in penmanship. Loss of smell. A decreased sense of smell, known as hyposmia, can sometimes precede motor symptoms in Parkinson's disease. Risk assessment for Parkinson's should involve evaluating personal and family medical history, as well as genetic factors if there is a family history of the disease. Early intervention and lifestyle modifications can play a significant role in managing Parkinson's disease effectively. Real-life examples, case studies and success story. To provide a deeper insight into the challenges and triumphs associated with Parkinson's disease, we present 5 compelling case studies and 5 inspirational success stories. Case study, Emma's struggle. Emma is a 65-year-old retired teacher who was diagnosed with idiopathic Parkinson's disease. Her journey through the various stages of the disease is an example of the challenges faced by many individuals with Parkinson's. Initial diagnosis. Emma's journey with Parkinson's began when she noticed a persistent, slight tremor in her right hand while trying to pour a cup of tea. Concerned about this symptom, she consulted a neurologist who conducted a comprehensive evaluation. This assessment included a detailed medical history, a thorough physical examination, and neurological tests, such as the Unified Parkinson's Disease Rating Scale, UPDRS. Imaging studies, like MRI and PET scans, were also performed to rule out other potential causes. The diagnosis confirmed that Emma had idiopathic Parkinson's disease, which means there was no identifiable cause for her condition. Early symptoms. At the onset of her diagnosis, Emma's primary symptoms included the aforementioned tremor in her right hand and slowness of movement. She also experienced muscle rigidity, making everyday tasks like buttoning her shirt or tying her shoes increasingly difficult. Her handwriting had become noticeably smaller and more cramped, a symptom known as micrographia. Medical interventions. Emma's neurologist prescribed medication to help manage her symptoms. She began taking levodopa, a medication that converts to dopamine in the brain, thus replenishing the diminished dopamine levels. Initially, the medication provided some relief from her tremors and rigidity, allowing her to continue her daily activities and maintain her independence. Lifestyle changes. Emma recognized the importance of lifestyle modifications in her journey. She engaged in regular physical therapy to improve her mobility and balance. Emma also made adjustments to her daily routines, such as using adaptive tools to assist with tasks like eating and dressing. She attended speech therapy sessions to address her speech difficulties, which had arisen due to the disease. Progression of the disease. Over time, Emma's symptoms gradually worsened, which is common in idiopathic Parkinson's disease. She began experiencing postural instability, leading to occasional falls. Her neurologist adjusted her medication to address these new challenges, often fine-tuning the dosage and timing. To manage motor fluctuations and off periods. Support network. Emma's family played a crucial role in her journey. Her husband became her primary caregiver, providing emotional support and assisting with daily tasks as her condition progressed. Emma also joined a local Parkinson's support group, where she found comfort in connecting with others facing similar challenges. She shared experiences and strategies for managing daily life with Parkinson's. Maintaining independence. Despite the progressive nature of her disease, Emma remained determined to maintain her independence for as long as possible. She continued with physical therapy and speech therapy, practiced mindfulness techniques to manage anxiety and depression, and explored adaptive technologies to assist with daily living. Conclusion. Emma's case illustrates the resilience and determination of individuals living with Parkinson's disease. While the condition presents significant challenges, early diagnosis, medical intervention, lifestyle modifications, and a strong support network can help individuals like Emma lead fulfilling lives despite the disease's progression. Success story. Peter's triumph over tremors. Peter's journey from struggling with debilitating tremors to regaining control of his life through advanced treatments and physical therapy serves as an inspiration to others. Learn more about managing Parkinson's disease in our specialized course. FAQ. Frequently asked questions. Here are 10 frequently asked questions about Parkinson's disease, along with concise answers. What is Parkinson's disease? Parkinson's disease is a neurodegenerative disorder that affects movement control due to the loss of dopamine-producing neurons in the brain. Is Parkinson's disease genetic? While some cases have a genetic component, the majority are idiopathic, without a known cause. What are the common symptoms of Parkinson's disease? Common symptoms include tremors, rigidity, bradykinesia, slowness of movement, and postural instability. How is Parkinson's disease diagnosed? Diagnosis is based on a clinical assessment by a neurologist, often complemented by imaging studies. Is there a cure for Parkinson's disease? Currently, there is no cure, but treatments can alleviate symptoms and improve quality of life. What treatments are available for Parkinson's disease? Treatment options include medication, physical therapy, surgery, deep brain stimulation, and lifestyle modifications. How can I reduce my risk of developing Parkinson's disease? Regular exercise, a balanced diet, and avoiding exposure to environmental toxins may lower the risk. What is the life expectancy for individuals with Parkinson's disease? Life expectancy varies, but most individuals with Parkinson's can live a normal lifespan with proper management. Can Parkinson's disease affect cognition? Yes, cognitive decline is a possible symptom, but it doesn't affect everyone with Parkinson's. How can I support a loved one with Parkinson's disease? Offer emotional support, help with daily tasks, encourage them to stay active, and consider joining a support group. To learn more about how to prevent Parkinson's disease, consider taking our comprehensive course. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.